smaller incision than we did years ago, but it is still not one of these micro mini type of incisions. It's a reasonable incision, but smaller than it was before. The beauty of it is that we don't destroy as much muscle tissue and ligament tissue as we had to do before. And also what has helped us in this regard is the invention of certain instruments that guide us when we do a knee, and the instruments have become much smaller and still give us the ability to line things up as we have to. So we don't do it through you can't do it through arthroscopy, like you can take out the cartilage of the knee. In other words, you don't do it through a little tiny hole and put a scope. You still have to make a reasonable incision, but we've learned how to make that incision without destroying as much tissues as we had to previously. So the basis of this thing is you know, again, I just want to demonstrate one thing. Can you hear me if I'm on the side? The knee is not just a pure hinge. It looks like it's a hinge. But when you squat down and when you bend, there's the femur and the tibia have a little bit of rotation to it. And the more you bend, the more there's a rotation. And as I pointed out, in women, it's even more than men. So that this type of rotating platform that we use allows this to rotate as you're bending, and there's less wear in that knee. So if the knee goes in, we hope this knee will last for years and years and years, and the rotation allows it to have less pressure on that, and it will hopefully last a much longer time. I'll be happy to answer some questions. Yes?
I've just a couple of questions. What is the average expected life of the joint?
You know, it used to be years ago. When I first started, I've been doing these since they started in 1970. And in that time, we really didn't know how long it would last. We used to tell people it would last for 10 years. So somebody would tell, they said you needed a knee, they say, well, you're too young, you better wait. We know now that actually knees have even held up, the ones we did years ago are holding up better than hips. And the knees that we put in now should last 30 years or more. They just work. Now, you know, it also depends on if somebody is 300 pounds, they're going to put a little more wear on it. But that's the beauty of this particular knee, is that there's less pressure on the plastic piece because the plastic is moving a little bit. So when you're moving, it rotates with you, and there's less wear on it.
Okay. I walk on a lot of slopes. How does that have any negative impact on that joint?
Not at all. The slopes have to do, you know, with your ligaments being stable, and that'll hold your knee. Here, and again, the rotating platform probably is helpful in that. But the knee is made so that it's almost the same as your knee before, except that it's a better surface that won't wear as much. So the angled hills should not make any difference. Yes, sir.
You do the traditional non-rotating operation.
Oh, yes. Yeah. I've done that for...
Pros and cons of both.
Right. Well, for years and years, and many people still do the traditional without the rotating platform. And that worked very well. And in many situations, it can work as well because we put it in years ago and it's still holding up. We think that this gives you a more natural motion because of the little bit of rotation to it. So it's actually the same thing, except it allows you to rotate slightly. And that's why we feel it's an advantage.
Are there any disadvantages?
Not really. Otherwise, it's actually the same pieces above and down below. Do we have that model of the knee? Can you give me that model? Yes.
Do you have to use metal parts in the artificial replacement?
Yeah, you have to use the metal top, and I'll show you in a moment, because it has to last. And
well, you say that the rotating platform is plastic, so how does that last?
Well, that's because it's a very strong, high-density polyethylene. And years ago, 20 years ago, that plastic wasn't quite as hard as they were able to get it now. And so that had some